talk to you today about hip shift in the squat, your weight shifting to one side or the other, which is a problem that I've had the better part of a year. And it's going to cause different pain, maybe knee pain from overcompensation, hip pain, and obviously just not be optimal for your squat because you're only using one leg instead of two. Dr. Quinn Henoch has been a great asset to me in helping correct this problem and work around it. So we're going to show you what it looks like, and Dr. Quinn's going to show you some simple drills to help you fix that problem.
So what you're looking for as Chad squats down is his hips in relation to his feet. So you're looking at the kind of the sides of his hips as he squats down. You can kind of see it slide over to his right leg. And at the bottom, if Chad sits at the bottom, you can see that the space between his hips and the floor is just a little bit different from side to side. And you can just see that he's favoring that right side. Something like that can be a million different causes. And what we had found was a pelvis that's kind of rotated towards the right leg, kind of more forward on that left side, and that was causing him to naturally shift over to that side. And that's something that's very difficult to correct, just telling somebody to do that underweight, let alone under 900 plus pounds. And so what we did was figured out a way for Chad to kind of use his adductors to stabilize his pelvis, and that way we could normalize things. And so we didn't demonize adductors, and we're certainly not cueing adductors in the sense that we want a knock-kneed squat, but we can use those smaller muscles to stabilize the pelvis, reposition it, and then we can center him a little bit better.
When you're getting under a max load lift, you can't be thinking, keep my weight on the left or on both feet. Like at that point, you really just have to squat. And the way that I was squatting was this shift to one side, and very, very apparent in the video of the 915 squat from the night lift event. It's something that has to be corrected in training with properly selected corrective drills, something that you can be conscious of during your warm-up sets, but once you get to those top sets, and especially as the session tends to go on and you fatigue, you can't be cueing to correct those problems. They have to be corrected in the neurological and structural standpoint of how those muscles are facilitating your movement.
Okay, so we had mentioned using muscles like the adductors or the muscles that are more proximal, meaning they're closer to the pelvis, as a way to stabilize and reposition so that the bigger muscles like the hamstrings and the glutes can then fire and create the power that we need. And so with Chad, we had mentioned that the pelvis was rotated in one direction and kind of dumped forward, and that was causing him to just naturally shift to one side. If a pelvis is oriented one side more so than the other, then muscles on both sides are going to be at different angles of pull. And so we're going to outline a couple drills that'll help reposition you, with the goal being restoring movement in all three planes. And so for the pelvis, we're going kind of this rotational plane, and also the ability for the pelvis to do this equally. And then for the hips, being able to rotate, flex, and rotate equally on both sides. We'll start with Chad on his back. And in this drill, we're trying to restore the pelvis's ability to stabilize in this sagittal plane, or this kind of front to back plane. We're gonna use the breathing and bracing sequence as a way to set position first. So Chad's gonna breathe in through his nose. He's gonna exhale all the way through his mouth. Exhale, 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 keep going. And he's just gonna feel those front ribs go down. And so that kind of pulls his pelvis back underneath him, and it gets that diaphragm and pelvic floor to face each other. And then what he's gonna do from there is just lift his tailbone maybe an inch off the floor. A light squeeze of the rollers is gonna recruit the adductors on both sides. And then what Chad's gonna do is this shift one side down. So if it's left side, the roller should spin counterclockwise, and you'll see that left knee go lower than the right. And so he can shift back and forth. And what we're restoring is that ability to do this. The next step here is, let's say you hold the right knee down, we're in right stance, and then try to take your left foot off the wall and hold for 2 full breath cycles. But he's trying to keep that right knee down and stabilizing that right side of the pelvis, recruiting that right hamstring. It's kind of a little hamstring curl here on the wall. Exhale all the way, and then reset and do the other side. Good, this foot on the wall, switch. So he's pulling down now with his left knee, so left knee goes down. And this may be the more important side for Chad, because he's already comfortable being on his right leg. So that was probably easier for him. This side, being able to shift into his left hip, and hold that position is a little bit more difficult because that's not what he's used to doing when he's in standing. So this is what we're really going to focus on. The second drill that we're going to do is inside lying. Head support's really important here, just so as girthy as Chad is, his neck would be hanging down, so you want something under his head. But it's the same idea. Think of this as more of a mobility drill of the hips. It's going to start with a light squeeze of the roller, again, to recruit the adductors on both sides, to stabilize that pelvis, and then we set with an inhale and an exhale to kind of brace that position. And then from here, it's a very similar idea in which Chad's going to pull his hip back and push his hip forward. So he's getting that movement in his pelvis and repositioning. So he's restoring that range of motion on both sides. And what you'll find as you flip from left to right and explore different ranges, that it's much more difficult for you to shift one hip back relative to the other side. And so that's probably where you need to spend more time. It's probably correlating to any type of shift that you have in your squat. For Chad, it was really important that we were able to get him back into that left hip so he could sit to that left side instead of always being over here. Something that we can do to manipulate is put this foot a little higher. And so now we have internally rotated the hip at the same time that he has to shift the pelvis from side to side. And just a really, really good way to get the hips moving in relation to the pelvis while he's just kind of stabilizing the entire system. So you get up, you retest your squat, and you should find that you just have a little bit more room from side to side. So 10, 15 reps, you can hold a position, take a few breaths, and then retest. Okay, so now that we've repositioned the pelvis, now we can start to recruit some of the bigger muscles. And I'm gonna outline a drill that everybody's probably seen before or experimented with. It's a very, very common drill where we put a band around the knees of the athlete while they perform the squat. This is a form of RNT, Reactive Neuromuscular Training, something that we're gonna go over again after this. But the idea is that the resistance causes the dysfunction that you're trying to correct. So in this case, it would be causing or feeding into a knock-kneed, shifty squat. And so what we're trying to get the body to do is reflexively learn how to push out. And so it may seem counterintuitive to feed the dysfunction, but it teaches the body how to correct itself. There's no complexity to this. He's just gonna simply squat with his newfound hip mobility, thinking about pushing equally through the insides of both feet. Now that doesn't mean his feet are collapsing. It just means that he's pushing equally and sitting into his hips evenly. So you want to think about sitting in between your feet as you're pushing against the band. And one common mistake is that you don't want to push the knees so far out against the band that you're rolling to the outside edge of your feet. You want to keep your feet grounded between those 3 points of contact that we always talk about: the big toe, the little toe, and the heel. Keep your weight balanced there. You don't want to shove out excessively. You think about, rather than varus knees or pushing out, what you want to think about is simply resisting the knees going in. So he's simply going to do his normal squat and just resist the pull of the band. And then when you take the band off and you retest your squat, you should find that the athlete's knees just kind of hinge and track naturally where they should go. And you've kind of preset that glute recruitment, and you can go right into your squatting.
This is a really simple drill to include in your warm-up. And when I was having a lot more adductor pain earlier on in this injury, I was actually doing entire squat sessions. I squatted a high bar PR 705 for 5 with band around the knees. So it's something that you can just implement into your training that you don't really have to take any extra time before or after, doing a lot of different drills.
So we move on to a drill that's part of a reactive neuromuscular training philosophy. And essentially what we do is we use bands or resistance to feed the dysfunction. And I'll show you what I mean. So I'm gonna take a band and around Chad's waist. So he shifts to the right, and I'm gonna pull the band so that it's pulling him to the right. And this may seem counterintuitive. You think, well, why would you want, if he's shifting to the right, why would you want to pull him to the right? But what it does is it teaches his body to reflexively push the opposite direction. And so the protocol here is what I typically do is maybe 5 reps of an air squat, and I'm giving enough resistance so that he has to fight it a little bit, but not so much that it's pulling him off balance. It's just enough for him to reflexively push to the left. But then we retest without the band, and you'll find that the athlete all of a sudden is like, whoa, you know, they're pushing over to that left side, and to them feels very, very crooked because for a long time their straight has been crooked. You pull them back the other way and they feel a bit off center, but then when you look at them, they're squatting straight down. We can do the same thing with the bar. We typically don't load this very heavy at all, and I'll use people, I use a kettlebell with people most of the time, but for Chad, you know, 70 kilos might as well be the empty bar. So same idea, and you can anchor the band to a rack, you can anchor it to a bench, whatever you want here, but it's the same idea. I'm giving enough pull so that he has to feel what it's like to push left, but not so much that I'm throwing him off balance. Retest your squat, do a before and after video, and you'll see that you're starting to sit straight down. You should see a change relatively immediately. So we're watching again, and that's way better, dude. We're looking at his pelvis in relation to how he sits down in between his feet, and from this compared to before, his pelvis is just sitting down a little bit more evenly. Now, if you don't reinforce this, you do the reactive neuromuscular training, you made a change, but then you just go and sit on your ass for an hour, it's gonna go away. These are transient neural responses, and so they don't last very long. So you've got to use them in conjunction with your training, and over time, they stick a little bit more and more, and then all of a sudden you don't have a shift anymore, you don't need to use that drill. It's a great correction, a great way to make a very fast change.
I'm Chad Wesley Smith.
I'm Marisa Inda.
I'm Maddie Rogers.
I'm T. Popula.
I'm Becca Day.
And I'm on my grind.